you've ever felt easily distracted, struggled to stay organised, or found it difficult to finish tasks, you might have wondered whether it could be ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, isn't just something that affects children. For many people, the symptoms actually continue into adulthood, sometimes without ever being formally diagnosed. I'm Dr. O'Donovan, and in this video, I'll guide you through what ADHD in adults looks like, what causes it, how it's diagnosed, as well as what treatment options are available. I'll also talk about self-help strategies, as well as the long-term outlook for adults living with ADHD. Now, whether you've recently been diagnosed, suspect that you might have ADHD, or you're supporting someone who does, this video is designed to help you feel more informed and supported. And as ever, I've included lots more useful resources as links in the description box if you do want to learn more. So firstly, what is ADHD in adults? Well, ADHD is a condition that starts in childhood, but for many people, it doesn't stop there. Now, while the way symptoms show up might change over time, the challenges can persist, especially with focus, attention, as well as impulsive behaviour. Now, adults with ADHD might find it hard to stay focused on tasks, stay organised, finish what they start, avoid distractions, or think through actions before jumping straight in. Now, in adults, hyperactivity, which is the constant movement we often associate with ADHD in children, does tend to fade, but issues like restlessness, difficulty with concentration, forgetfulness, and impulsive decision-making can still cause significant problems in adult life. Now, these difficulties can affect things like work, relationships, emotional well-being, and daily routines, especially in environments that lack structure. So just how common is ADHD in adults? Well, depending on the source that you use, ADHD affects around 3 to 4 in every 100 adults. Now, for comparison, about 5 in 100 school-aged children are diagnosed with the condition, and in up to 2/3 of those children, symptoms do continue into adulthood. Now, in children, ADHD is diagnosed more often in boys, but in adults, the numbers are more balanced between men and women, and that's partly because inattentive symptoms like forgetfulness or trouble concentrating are sometimes missed or mislabeled in younger girls. So what are the symptoms of adult ADHD? Well, symptoms can vary widely from person to person, but in adults, it usually includes a combination of inattention and impulsivity. For diagnosis, these symptoms must have started before age 12, be present in multiple settings like at work and home, and have lasted at least 6 months. Now, inattention symptoms might include difficulty focusing for long periods, making careless mistakes at work or with daily tasks, losing things like your phone, wallet, or keys, being forgetful about appointments or plans, trouble organising or completing tasks, struggling to follow through on instructions, or feeling overwhelmed by tasks that require sustained mental effort. Now, impulsivity and hyperactivity symptoms might include feeling restless or on the go constantly, interrupting people or talking over others, trouble sitting still, especially during long meetings or conversations, making snap decisions without thinking things through fully, or difficulty waiting your turn, whether that might be in queues, conversations, or traffic. Now, not everyone with ADHD has all of these symptoms, and sometimes the symptoms might overlap with other mental health issues like anxiety, depression, or substance misuse. So it is important that a professional diagnoses ADHD and you don't do this yourself. So just how is ADHD diagnosed in adults? Well, if you're noticing symptoms that are affecting your daily life, your first step is usually speaking to your doctor. They might refer you to a specialist, often a psychiatrist or neurodevelopmental team with experience in adult ADHD. Now, the assessment might include talking through your current symptoms and how they affect you, a review of your childhood behaviours and history, input from someone who knows you well, such as a partner or a family member, questionnaires, as well as screening tools. Now, to receive a diagnosis, your symptoms must be clearly interfering with your work, relationships, or general well-being. Now, other possible causes like anxiety or learning difficulties may also need to be ruled out. So what causes ADHD in adults? Well, ADHD is influenced by a combination of genetic, environmental, as well as neurological factors. It often runs in families, and if a parent or sibling has ADHD, your chances of having it are higher. Brain imaging studies suggest that certain areas of the brain that control attention and impulse regulation may develop differently in people with ADHD. Other factors can include low birth weight, smoking or alcohol use during pregnancy, being premature at birth, brain injuries or neurological conditions, or autism spectrum conditions, which often co-occur with ADHD. Now, in many cases, there is no single cause, and having one or more of these factors doesn't mean someone will definitely develop ADHD. So how is ADHD treated in adults? Well, the main treatments for adult ADHD include medication, psychological support, as well as practical strategies to manage symptoms. So in terms of medications, medication is often offered when ADHD symptoms are having a significant impact on your daily life. Common first-line options include lisdexamfetamine, methylphenidate, but if these don't work or cause side effects, alternatives are available. Now, these medications work by adjusting the balance of certain chemicals in the brain, particularly dopamine and noradrenaline, which play a role in attention and impulse control. Now, side effects might include poor appetite, sleep difficulties, or increased anxiety, but many people do tolerate the medication well and actually do notice improvements in focus, energy, as well as confidence. Now, the next option is psychological support. Medication is most often effective when combined with other types of help. This can include cognitive behavioral therapy, or CBT, to help with managing emotions, stress, and routines, coaching or structured support focused on goal setting and organization, mindfulness or relaxation techniques to help reduce overwhelm, as well as psychoeducation, so learning more about ADHD and how it affects you. Now, in some cases, support might also include counselling or being referred to a community mental health team, especially if there are co-occurring conditions like anxiety or depression. So what can you do to help yourself? Well, in addition to professional support, there are many practical things that you can do that might help manage your symptoms. So firstly, using reminders, calendars, or alarms to help with forgetfulness can be very helpful. You might also want to break large tasks into smaller, more manageable steps. It's also helpful to sometimes set regular routines for sleep, meals, and work, or even using sticky notes or checklists to stay on track. Other people find physical activities that they enjoy, like walking, running, dancing, or sport, as well as setting realistic goals and rewarding yourself for meeting them. And also try to avoid overloading your schedule. Now, some people find self-help groups, online forums, or apps to be helpful as well. And if you are working in the UK, ADHD is classified as a disability, meaning that your employer must consider reasonable adjustments to help you do your job properly. So please remember this. Now, can ADHD get worse? Well, in many cases, ADHD actually becomes easier to manage with age, especially if you develop some coping strategies. But sometimes the symptoms can feel worse if life becomes more complex or stressful, which obviously over time it can do. Now, the hyperactivity tends to settle, but difficulties with focus, memory, and impulsivity may still cause problems, especially in unstructured environments or jobs with a high workload. And that's why ongoing support, workplace adjustments, and a good understanding of how ADHD affects you individually are so important. So in summary, ADHD isn't just something that affects children. Many adults also live with it, whether or not they were diagnosed when they were younger. If you're finding that forgetfulness, distraction, impulsivity, or even disorganization are making life difficult, it is worth talking to your doctor. A proper diagnosis can help you access the support and treatment that you need and deserve. And with the right strategies and sometimes medication, people with ADHD can lead very full, successful, and meaningful lives. Now, if you'd like to learn more about ADHD and you want to explore this topic further, I can recommend Mind UK, which is a great resource for understanding ADHD as well as mental health in general, ADDIS or AADD UK, which are UK-based charities which provide great peer support and advocacy for people with ADHD, and I've then put links to these in the description box of the video. If you found this video helpful, or if you have ADHD and you want to share your experiences to help others who are beginning to find out more about this, please do so in the comments section, and why not check out this video next.